Good afternoon, everyone. So I will be discussing the recent evidence on off-clamp versus on-clamp robot-assisted partial nephrectomy in terms of perioperative outcomes. So we are going to discuss these two papers. One is a propensity-matched analysis from Buttikuti database, and the other one is a systemic review and meta-analysis. So the use of clamping of renal vessels during partial nephrectomy has its own benefits in terms of decreasing the blood loss, as well as increasing the visibility during the tumor cutting. However, it does predisposes the kidney to ischemia, which is called as warm ischemia time, and which has been identified as a predictor for short and long-term renal function preservation. However, the use of warm ischemia time as a marker to predict the renal functions and the perioperative outcomes has been questioned. Even with the emerging evidence, although the advantages of off-clamp over on-clamp partial nephrectomy has blurred, the surgeon experience and preference are predominant in deciding on the technique used for hilar clamping. These are some of the evidences with the contradictory results. Some of the studies have found that there is no difference between the two groups in terms of perioperative outcomes and renal function preservation. However, some studies have shown that off-clamp partial nephrectomy is superior to preservation, is superior in terms of preservation of the renal functions. These all studies had their own limitations, especially in terms of lack of comparability between the two groups. So this was a propensity-matched analysis, 1:1, where both the groups were compared. The database for this study was Buttikuti database, which is a prospective multinational collaborative database. And the data from 18 institutions and 9 countries was included in this study. The primary objective of this study was to compare the perioperative and functional outcomes between the patients from the two groups. So from 2014 to 2020, total of 3,800 patients were added to the database. And out of this, around 2,100 patients were selected who had complete data set. Out of those 2,100, 210 patients underwent off-clamp partial nephrectomy, and around 1,900 patients underwent on-clamp partial nephrectomy. The propensity matching was done for the patients and for age, sex, BMI, renal nephrometry score, and pre-operative estimated GFR. Total of 205 patients were taken in each group. And you can see that post-matching, both the groups were comparable in these parameters. The perioperative outcomes showed that the intraoperative transfusion need and the need for conversion to radical nephrectomy was significantly higher in patients who underwent partial nephrectomy without renal hilar vessels clamping. The rate of positive surgical margin was higher in patients who underwent hilar clamping. However, this was statistically not significant. The rates of complication, as well as the perioperative estimated fall in GFR, was similar in both the groups. So the authors concluded that the off-clamp partial nephrectomy offers no advantage in renal function preservation compared with on-clamp partial nephrectomy. However, patients who undergo off-clamp partial nephrectomy have significantly higher conversion rate to radical nephrectomy and need for blood transfusion. The authors recognized some of the limitations in this study. To name a few, it was a retrospective analysis. Because of the different centers which contributed to the data, there was operative heterogeneity in terms of surgical experience, surgical techniques. There was no uniform central review of the radiological reporting, especially for renal nephrometry score. And there was lack of data on operative details, especially in terms of use of technique for tumor resection and use of adjunctive techniques like use of intraoperative ultrasound or frozen section, which could have affected the rates of positive surgical margin. The second paper is a systemic review and meta-analysis. The primary aim of this study was to compare the percentage decrease in estimated GFR between the two groups, with the secondary aims to calculate the difference between the operative time, length of hospital stay, blood loss, need for blood transfusion, and positive surgical margin. Total of 11 studies were included in this study, where out of which 2 were randomized controlled trial and 9 were matched cohort studies with a total patient base of around 2,500 patients, out of which around 950 patients underwent off-clamp partial nephrectomy and around 1,500 patients underwent on-clamp partial nephrectomy. Coming to the analysis of the primary outcomes, there was no significant difference between the 2 groups in terms of percentage decline in estimated GFR. Coming to the secondary outcomes, there was no difference between the 2 groups for complication, need for blood transfusion, intraoperative blood loss, or conversion to open or radical nephrectomy. Again, there was no difference between the 2 groups in terms of length of hospital stay. However, in the patients who underwent off-clamp partial nephrectomy, the operative duration was significantly shorter. However, this was probably biased because of the single study. After the further analysis and when this on sensitivity analysis, when this study was removed, the operative time difference between the 2 group was significantly not different. The positive surgical margin rate was lower in off-clamp group. So to summarize, in systemic review and meta-analysis, they found that both groups were comparable in terms of perioperative outcomes, especially the drop in estimated GFR. So the take-home message is that avoiding clamping of the renal artery does not provide any clinically relevant benefit in preserving renal function. And it also doesn't add to any potential harms in terms of intraoperative bleeding or any other perioperative complications. Thank you.